Hello there, my name is Rich. I'm a Medical Laboratory Technologist. This is my avatar who will be guiding you through this Pecha Kucha PowerPoint presentation on assessing the peripheral blood smear for PIDP 3240 Media Enhanced Learning Assignment 4. The intended audience for this Pecha Kucha slide presentation is towards first-year Medical Laboratory Technology students and Medical Laboratory Technologists who need a refresher in performing a manual differential of the stained peripheral blood smear. The peripheral blood smear is an important laboratory test to help healthcare practitioners in the assessment, diagnosis, treatment, and monitoring of patients. Manual differentials encompasses counting and delineating white blood cells, morphology of red blood cells, and a platelet estimate. There are three objectives to this Pecha Kucha PowerPoint presentation on assessing the peripheral blood smear. First, describe how to perform a macroscopic assessment. Second, describe how to perform a microscopic assessment. And finally, increase confidence in performing a manual differential. There are two parts to assessing the peripheral blood smear. The first part is the macroscopic assessment. This is where the slide is looked at for its identification and also looked at with the naked eye to ensure the quality of the smear and slide is good. The second part of the assessment of the peripheral blood smear is the microscopic assessment. This is where the slide is literally put under the objectives and viewed through the oculars to ensure the quality of the smear and slide is good. The unstained and stained slides to the left represent an ideal peripheral blood smear. The shape looks like a bullet with 2/3 the length of the slide and a thicker end at the frosted side. There should be uniform staining without debris or artifact. The cluster of slides to the right represent poor quality slides. Microscopically, the peripheral blood smear is viewed under low power or ocular objective 10. The middle slide is a view of 10 power. Note how small the cells appear. The slides to the right is a higher power objective. Note how much larger the cells are. Under 10 power or low power objective, the overall goal is to search for unusual cells, large cells, platelet clumps, rouleau, agglutination, white blood cell distribution, and a white blood cell estimate. Start scanning the slide from the tail or thinner regions and move towards the thicker regions. Under the mid-power or 50-power objective, begin the differential at the monolayer adjacent to the feather region. Advance the ocular fields unidirectionally so each field is adjacent to each other. Move vertically and laterally from the thinner to thicker regions of the peripheral blood smear. Finally, under the mid-power or 50-power objective, look for toxic changes in immature white blood cells. The slide to the left represent normal white blood cells. The center slide represents toxic changes to a neutrophil, and the slide to the right represents immature or young white blood cells. Next, switch your lens to the high power or 100-power objective. The overall goal is to confirm white blood cells, scan for red blood cell morphology, scan for platelet morphology, and perform a platelet estimate. Notice how large the cells appear to the slides on the right. Under the high power or 100-power objective, confirm immature white blood cells by moving from low or mid to high power. High power allows you to identify the details and classify each white blood cell, as evidenced by the slide to the right. Under the 100-power or high-power objective, grade the anisocytosis or variation in red blood cell size. A normal red blood cell is the size of the nucleus of the small lymphocyte or peripheral cell in the slide. Note the size variation of the red blood cells as compared to the nucleus of the lymphocyte. Next, under 100 power, grade the variation of red blood cell shape or poikilocytosis. Red blood cells are normally round and biconcaved. However, poikilocytosis is seen on this slide. Number 1 represents elliptocytes or ovalocytes. Number 2 are teardrop cells. And number 3 are target cells. Next, under 100 power, assess anisochromia or variation in red blood cell color. Normal chromic red blood cells have a central pallor or hole that is less than 1/3 the diameter of the cell. The slide to the left represents hyperchromic red blood cells, whereas the slide to the right represents hypochromic red blood cells. Next, under 100 power lens, scan for red blood cell agglutination, which appear as clumps of red blood cells to the slide on the left, rouleaux, which are stack of coin-like appearance to the middle slide, and look for red blood cell inclusions. The purple dots are Howell jelly bodies in the red blood cells to the slide on the right. Finally, under the 100 power lens, assess the platelet morphology and platelet estimate. The platelets are the small purple dots to which the black arrows are pointing on the left slide. Clumps of platelets are seen on the right slide. Do a platelet estimate and ensure it is within 25% of the actual platelet count. Next, switch your ocular to the mid-power or 50 power objective. Look for the monolayer to begin your 100 to 200 cell differential count. The monolayer is adjacent to the feather region as indicated to the slide on the right. In the monolayer, there should be no overlap of red blood cells. Any peripheral blood smear that appears abnormal and falls under the criteria for referral should be sent to the pathologist for confirmation and possible causes or diagnosis for the abnormality.